using autorefractometer, a very simple and effective tool. I have no financial interest to disclose in this paper. So meibomian gland dysfunction is a major cause of dry eye syndrome. Morphological changes include tortuosity, shortening, dropouts, dilatation and distortion. These can be precisely measured using meibography, which is very expensive tool, and it would be available only in major institutes. We describe here a very simple technique which day-to-day practice every practicing ophthalmologist can apply to view the meibomian gland morphology using a simple autorefractometer. So the aim of the study is to study the morphological pattern of the meibomian glands using autorefractometer. So this is a prospective non-interventional study. Study period was between January 2019 to March. Sample size 60 eyes of 30 patients diagnosed with meibomian gland dysfunction, that is, which includes symptoms, meibomian gland blockage, expressibility, lid margin telangiectasia were studied. This was the age group, majority between 50 to 60 and up to 80 age group was included in the study. Most of the patients presented with burning, foreign body sensation, and itching was seen in some amount of patients, and reflex tearing in 5.8% of the patients. Ocular surface disease index score was assessed on a scale of 0 to 100. Higher the score, greater the disability. The range was between 25 to 69.4 and the mean was 47.2. So it was mild in 25 eyes, moderate in 15 eyes, and 20 eyes had very severe dysfunction. Lid margin changes include meibomian gland block of various degrees, which I will be showing later. Almost all the patients had meibomian gland block. Frothing was seen in 24 eyes. Vascularization, keratinization and rounding up of posterior lid margin were seen. Tear film height was studied. It was 0.25 in 75% of the patient and 0.5 in 30% of the patients. Tear film breakup time was less than 5 mm in 25 eyes and 6 to 10 mm in 5 eyes. Meibum expressibility scores was assessed from 5 glands. If all the glands were expressible, the score was 0, and score 1 means 3 to 4 glands are expressible, score 2 1 to 2 glands, and if there are no glands are expressible, the score is considered 3. So majority had a score of 2, that is 50% of the patients. The secretion, quality of the meibum secretion was also assessed. It was assessed in each of the 8 glands of the central third of the lid on a scale of 0 to 3 for each gland. Score 0, when you express, the content was a clear meibum. Score 1 was a cloudy meibum. Score 2 was cloudy with debris, granular debris, and score 3 was thick toothpaste-like excrescences. So in this, 32 eyes had score 1, 26 had score 2, and 2 had score 3. Meibomian gland dropout score was also studied. It can be partial or complete. It was obtained from upper lids using a subjective 4-grade scoring system. Grade 0, all the meibomian glands were present. Grade 1, the gland dropout area was less than 1/3 of the total meibomian glands. Grade 2 was 1/3 to 2/3, and grade 4 was total gland dropout. So this is the meibomian gland dropout score, which was grade 2 in 37 eyes, grade 1 in 18, grade 3 in 3 eyes, and grade 4 in 2 eyes. So normal meibomian gland architecture, as you do autorefractometer, you can just invert the lid, and these infrared rays clearly capture the meibomian gland architecture. Here you can see the nice normal course of the meibomian glands. And towards the left, you can see the dilated glands, and towards the right, where they are very dilated, tortuous, filled with all these sebum. And clinical picture, you can see the lid margin changes, telangiectasia, then plugging of lid margins, plugging of secretions, etc. Here partial dropout can be seen in the left side of the picture, where very few glands, the two very irregular outline can be seen. And on the towards the right, there is a total dropout. No meibomian gland architecture can be visualized in this. So the clinical picture is compared below. It's very poor outcome. So in these patients, you have to not many substitutes are available. So with the help of the autorefractometer, you can come to a conclusion like whether it is salvage, can be salvaged by medical therapy, or it will require advanced therapy like IPL or LipiFlow. So to conclude, the autorefractometer is a simple, inexpensive tool that can be effectively used in assessing the meibomian gland morphology in day-to-day practice. This would help us in precisely diagnosing the etiology, diagnosing the level of meibomian gland dysfunction, and thereby indicating appropriate therapy. Thank you for your patient listening.